Eccoci qua.
Here we are on the second International COVID Summit, ICS. I am very happy, and I would like to thank the committee that have allowed and organized this amazing Congress with columns that have already spoken before me, as Professor Malone, Professor Montagnier, that unfortunately isn't here with us anymore, and many other people that have spoken and will speak. Therefore, I thank Reign for Liberté, Reign for COVID, ainsi que Enseignement et Liberté. I have chosen as title, Therapy Errors, the Mistakes of the Therapy. Why? Because it have already passed 2 years, more than 2 years, since we have been curing COVID in all of the world, since when we have started searching for solutions that do not depend from governments, but from the heads of doctors. Because the duty of a doctor is that of attempt to heal his patients without thinking only about the guidelines, the schemes of robots that have been given to us, but attempt to heal them, visit them, and heal our proper patients. After 2 years, I have healed at least 5,000 patients. 5,000 patients, both at home and in telemedicine and in hospital. And the youngest patient of mine had 6 months, the oldest had 101 years, and now has 102 years, and he is healed. We must understand what is COVID-19 and how he acts. Therefore, excuse me, but I would like to make a brief introduction to what is the disease of COVID, in my opinion. SARS-CoV-2 is an RNA virus that mutates continuously, without steps of variants, but continuously mutates every day. And therefore, it is why the vaccinational therapy isn't efficacious because we are making vaccinations on viruses that have been isolated in Wuhan in 2019. It is like the virus of influenza, even if it's a disease that is much more serious. That doesn't allow us to utilize a virus of a 2-year-old virus. It doesn't work this way. Additionally, since it is an RNA virus that mutates continuously, it is unfortunately impossible to achieve immunity, permanent immunity. If I have gotten a cold 2 years ago, this is not the reason because I cannot get a cold this year. SARS-CoV-2 is a virus that works this way. But be careful, it has a difference between other viruses. It is a respiratory virus that can be gotten only by inhaling the breath of another person that has that virus by emitting a droplet, a small drop that contains hundreds of the virus. This is why the mask can't stop the virus, because the water of the droplet is absorbed by the tissue of the mask. Therefore, it enters our lungs, generally, most likely the left one, in the 70% of cases. When it enters the lung, even if it is told to us that only certain persons have pulmonitis, it is more than that, because in the moment the virus enters a cell, it creates an inflammation and an infection. And in medicine, it's called a suffix with ite. If I have a gingivitis that has an infection, it's called gingivitis. If I have a lung that is infected, it's called pulmonitis. In this case, a certain pulmonitis, interstitial pulmonitis, that goes to attack the structure of the lung, making it less elastic. Therefore, the alveoli become less elastic. Those are the sounds we hear crackling when we breathe. And that is what we try to hear when we listen to the patient's lungs. It seems like a normal respiratory disease. However, this virus has some peculiarities that other respiratory viruses do not have. This makes us think that it is not a natural virus. Why? Because this virus goes, once it enters our lung, doesn't colonize only other cells of the lung tissue, but through the hepatic current of the blood, it attempts to attack any cell in any tissue in any organ, from the brain, from the skin of our toes, and everything that is in between. This is a peculiarity of this virus, but there is a second that is very important. This virus is made to go colonize the bacteria of our microbiota flora of the intestine, and it is there that it goes to reproduce, and it goes there to tank as well. And what are the mistakes? After 2 years, we can say that, after having spoken with the hundreds of doctors in the world, we can say that it is the moment to make an autocritic to ourselves. Where have we made a mistake? The biggest mistake that we have done is to have waited. We must never wait. We must start the therapy immediately at the first symptom, without waiting, not even the result of a PCR test. We must start immediately, especially with anti-inflammatories. There is an important research by the Mario Negri Institute, Italian ones, that demonstrates we can reduce more than 94% of recoveries in hospital only with anti-inflammatories. But be careful. We have two categories of people, of patients. The patients that are naive, that take the virus for the first time, and those that can re-get the virus and get reinfected. Why is this difference important? Because people that are asymptomatic, that don't know that they have gotten the virus, and then that when they re-get the virus the second time, have the risk that the cytokine storm that occurs when the antibodies, specific antibodies, form in people that are genetically prone to get the virus. The antibody production doesn't occur in 2 weeks as in virgin naive patients, but having already a memory of the genetics of the antibodies, the cytokine storm can form in only 3 days. And this occurs mainly in patients that have already gotten the asymptomatic version of the virus without knowing it, that are very young and healthy. Therefore, the first time which have beaten the virus and their defense system has been has been able to defeat the virus, but the memory of the antibodies and the genes is still there. So therefore, when they get this virus for the second time, they already restart producing the antibodies in 3 days. Another mistake that we have made is to focalize too much on molecules, which are very efficacious. All of these that you see here are efficacious, starting from plasma hyperimmune, hydroxychloroquine, and ivermectin, and many other chemicals. They work, but they are useful. If they are useful, and they are useful, they are not necessarily essential. COVID can still be healed with less efficacious, not off-label chemicals, such as anti-inflammatories, cortisons, antibiotics, certain molecules as bromhexine or N-acetylcysteine, and probiotics. Anti-inflammatories are fundamental. Any anti-inflammatory is efficacious. Cortisone, that is also criticized, saying that they mustn't be used immediately. I have spoken earlier about reinfections. How can we prevent a cytokine storm that occurs in 3 days if I must wait that the patient worsens and a week before giving cortisone? The only way to prevent the cytokine storm, therefore, the transformation from a viral respiratory disease into a, which we have seen isn't only respiratory because it does damage to other organs, that transforms after the cytokine storm into an auto self-immune disease. It's not, the enemy is not anymore the virus, but our antibodies. The only way to avoid this is to use cortisons. Why do we use antibiotics? Since it's a viral disease, you may ask, why do we need antibiotics? As I said, the virus is a bastard. It goes into the bacteria because the bacteria are much more numerous for the virus, because it reproduces inside of the bacteria and it hides inside of the bacteria and where it is tanked. Bromhexine is a simple medicine that unfortunately isn't present in any country in the world, in not all countries of the world. You don't even need a prescription for it. We have seen since spring of last year that it blocks the receptors of healthy cells, therefore impeding the virus to infect new cells that are healthy. The acetylcysteine instead has an important action on glutathione, which heightens the level of glutathione in the body. Why are probiotics important? Because we must clean away the infected from COVID-19 intestinal flora, and we must continuously exchange it. We must use integrators as probiotics that are resistant to antibiotics. Unfortunately, not in all countries, such as the United States and Canada, they do not exist. Wrong doses. Doses are very important. We know what are the correct doses. For example, dexamethasone should be given in doses of 3 milligrams in the morning and after 12 years, and after afternoon, other 3 milligrams. I have seen, having spoken with colleagues in the world, that give higher doses of cortisons. Some don't even give any to it. Others give too little. Another mistake that is done is with vitamins and integrators. Be careful, they all work. However, they are not in any way able to prevent and heal by themselves the disease. If we give 15 medicines to the patient will not only have to spend lots of money. However, he will also tend to take away other medicines from those that he has prescribed. And that patient will worsen. Another mistake that we do often is that of thinking only to the pulmonary interstitial pulmonatis. We must look also at other organs because contemporaneously are infected many other organs. And what seems most observable is when it affects the brain, or when people can become depressed, aggressive, or have a confusion in their mind and lose their own memory. Be careful. We do not look and listen only to what happens at the level of lungs. As I have said, the intestinary flora has 30% more bacteria here, and it is easier for the virus to enter a cell of a bacteria because the bacteria cell does not have an immunitary specific system as our cells, such as lymphocytes and macrophages. Therefore, for a virus, it is very easy to enter and colonize a bacteria, and after a little time, thousands of viruses leave it. Therefore, it is exponential. Another thing, as I said, that is very important that this virus does at the bacterial level is that it hides and tanks inside of them. Therefore, this explains long COVID. If we do not work on the intestinary flora, we risk to have a COVID that stays in our body. The saturation, another very important discussion. Many doctors that heal COVID still haven't understood that saturation isn't very important at the beginning, because at the beginning saturation is good. However, with pulmonitis, with interstitial pulmonitis, it starts slowly to decrease. You can see the saturation that in 24 hours decreases by 1%. So we start to get alarmed. However, the time is fundamental when we measure saturation in order to understand how the patient is, because if the saturation falls by 5-6% in 1 hour or two, it means that we are already in full cytokine storm, because the microtrumps form in the cytokine storm. Therefore, small coagulations that have not been seen in plaques, that often cannot be measured, but we still know from autopsies that they have been formed, and they do not form only at pulmonary level, also at pulmonary level. And the saturation shows us how these microtrumps are closing small passes for the air in the blood. I make 3 examples. Maurizio, this could have been my fault, probably. What was the mistake? To have been merciful. The patient that has 50 years, but strong with small risks, few risks, had all his infected family and said that he was well and wanted to do the therapy. He said, okay, if you think you feel well, it's fine. But with time, he started saying that he has problems. So what have we waited for? 2 days. We have waited 2 days too much because I have not insisted. This was my mistake. And Maurizio found himself with tubes of air in the hospital because he had been reinfected, because he had already gotten the asymptomatic version of the virus and therefore had the cytokine storm in less time. Tony, second case. Tony is already famous for the people who follow me. Tony was in Canada and had been treated already by a colleague, a good colleague, a famous colleague. However, he made a mistake. He did not give him heparin to prevent the formation of microthromps. Therefore, Tony found himself in a hospital one day in first aid hospital with saturation that decreased by 5 points in 1 hour. His wife, that is very good, Lily, understood that something wasn't going well and called me. If she had not understood this and did not give me all of this information of his situations and exams, such as the dimeter was high, I would not have been able to advise his doctor, his Canadian doctor, that is also famous, to give him immediately high dosages of heparin. I only had a saturation that was under 90. And in 48 hours with heparin, he arrived to 99. And be careful. After 3 days, 72 hours, he became negative from COVID. What was the mistake? The mistake was not to give him heparin immediately and not give him the correct dosages and give the wrong type of cortisone. Roberto, third case. Roberto was another mistake because Roberto was left for 1 month without any therapy. When he had been brought to hospital, his saturation was 67%. Immediately, when I managed to intervene in the situation, I gave him the correct dosages of heparin for a case as such, in which there was already a high decimation of microthromps. Therefore, heparin dosages in that case got doubled. Roberto, unfortunately, wasn't able to survive because in 24 hours, we managed to bring him to 90% of saturation. He had 82 years, many pathologies, diabetics, heart diseases, and his heart did not survive, so we did not win. Another mistake that is important is to stop the therapy too early. This is a very big mistake, to stop the therapy when you already feel better, because if we do not continue with the therapy for at least 2 hours after he has become asymptomatic, we risk that there will be a refall into COVID that often is worse than the first phase, and we risk long COVID because, as I said, the virus isn't eradicated completely and therefore can show itself back again and give us long COVID. I thank you all for the attention, the organizers, and see you at the next ICS. Thank you.